Good morning, everyone. My name is Eric Vandewall, and I'm the President and CEO of Joseph Brant Hospital. I'd like to welcome you all to today's special announcement. I'd also like to extend a warm welcome to our dignitaries who are here with us today. Premier Doug Ford, Sylvia Jones, Minister of Health and Deputy Premier, Michael Tibollo, Associate Minister, Mental Health and Addictions, Natalie Pierre, MPP for Burlington, Effie Triantafilopoulos, MPP for Burlington and Oakville, Marianne Mead Ward, Mayor of Burlington, and Gary Carr, Regional Chair, Halton Region. Our first speaker today is Natalie Pierre. I've had the opportunity to work with Natalie and to get to know her well over these past few years. Natalie is kind, she's tenacious, she's very bright, and she deeply cares about the well-being of people. Natalie, where are you? It's been a pleasure and a privilege and an honor to work with you over these past few years. Thank you for your leadership, thank you for your advocacy, and thank you for your support of Joseph Brant Hospital. Natalie Pierre.
Well, thank you, Eric, and good morning, everyone. Thank you all for being here this morning to celebrate a monumental announcement in mental health and addiction care right here in Burlington. I'd like to welcome Premier Ford, Minister Jones, Associate Minister Tibollo, and MPP Triantafilopoulos from our government caucus. I'm so happy to have you all here and thank each of you for your support in making today's announcement a reality. Today's announcement will make a tangible difference in the lives of patients and families in our community, ensuring that individuals and families receive the care and support they need close to home. Today's announcement will also help foster stronger connections between patients, families, and caregivers, and creates a network of care and support for residents in Burlington and surrounding communities. This kind of meaningful change required the commitment and collective determination of many partners who rolled up their sleeves to get it done. And for this, we have many people to thank. To Premier Ford, Minister Jones, and Associate Minister Tibollo, I want to express my heartfelt gratitude for your commitment to mental health and addictions care in Burlington. This investment in our hospital is a testament to your dedication and leadership in improving the health and well-being of people across our province. I'd also like to thank our healthcare professionals, hospital staff, the Joseph Brant Hospital Foundation, and our generous benefactors, Michael and Laura Paletta. A very special shout out goes to the JBH, so the Joseph Brant Hospital Patient Family Advisory Council, who have worked together for years to make today a reality. Today, we celebrate building a stronger, healthier future for all of us. I am now pleased to welcome the Associate Minister of Mental Health and Addictions, the Honourable Michael Tibollo, to the podium.
Good morning, everyone. It is truly a pleasure for me to be here this morning with the Premier, my colleagues from the Ministry of Health, Minister Jones, and my wonderful parliamentary assistant, Natalie Pierre, who just celebrated birthday, and I want to say happy birthday to you again. I want to start off by thanking Natalie for her tireless work to make today a reality. I remember when she first spoke to me about this, just how anxious and how dedicated and how much she wanted to see it get done. And you know, like Walt Disney said, if you dream, keep dreaming, and with hard work, that dream will become a reality. She has been a champion for this project from the beginning, and I know that it's going to have a tremendously positive impact on those struggling with mental health issues in the region, as well as on behalf for their loved ones. Today's announcement is another step forward in fulfilling the commitment we made in the Roadmap to Wellness to expand and improve the quality of mental health services across Ontario. When we took office in 2018, we inherited a mental health and addiction system that was in complete disrepair for decades of neglect by previous governments. There was chronic underfunding, siloed approaches, and outdated infrastructure. The Premier knew that we needed to change, which is why we created an unprecedented $3.8 billion plan to overhaul and modernize how we deliver mental health in the province of Ontario. And so far, we've increased annual funding for mental health and addictions programs by over $800 million and funded over 500 new addiction treatment beds in communities across the province of Ontario. Today, we're continuing to build on that progress by helping people in Burlington access safer, cleaner, and more effective mental health care right here close to home. I want to thank you all again for being here this morning and give a special thank you to Eric and his team for the incredible work that they do here at the hospital and the commitment that they have for this project and to the people of Burlington. And now I'd like to hand over to Minister Jones to speak. Thank you very much.
Thank you, Michael, and good morning, everyone. It is indeed great to be back in Burlington along Premier Ford, Associate Minister Tibollo, and of course your local MPP, Natalie Pierre. She truly has been a champion for this project in your community and at Queen's Park, and a fierce advocate for building a connected healthcare system in Burlington, but also across the province. I also want to thank the entire team at Joseph Brant Hospital for hosting us today, and for all that you do to provide families in Burlington and across Halton Region with exceptional care each and every day. Today is an exciting day, and it is an honor to be here to celebrate with you. Under the leadership of Premier Ford, our government has been making record investments in healthcare to provide more people with the right care in the right place. We are expanding capacity across our hospital sector. We're getting shovels in the ground for over 50 hospital developments. We're investing to modernize hospital infrastructure by supporting critical upgrades and repairs. And we are improving access to diagnostic imaging with a record 49 new MRI machines across Ontario, including right here at Joseph Brant Hospital. We are increasing access to primary care, like through our expansion of interdisciplinary primary teams, to connect every person who wants a primary care provider to one within the next 5 years. Here in Burlington, our expansion of the Burlington Family Health Team has meant we are connecting 4,400 more people to primary care right here in your community. Our government is also improving access to key services, such as mental health and addiction support. In January, I visited the Reach Out Centre for Kids in Burlington with MPP Pierre to announce over $44 million in annual funding for children and youth mental health services in your community, including training an additional 2,200 clinicians to provide better care to children and youth with complex service needs. Our government has achieved great progress, and we continue to take action to ensure all Ontarians at every stage of life can connect to the care they need when they need it, closer to home. Thank you again to the team at Joseph Brant Hospital and all of your community partners who have made today's announcements possible. Together, we are making it faster and easier for families in the Burlington area to connect to high-quality care and support. And now it's my pleasure to turn it over to Premier Ford, who is leading these initiatives, to share a few words. Stay well.
Well, good morning, everyone. It's a pleasure to be back here in Burlington. What a beautiful town. And alongside, as you've heard the whole list, but I'm going to make sure we repeat it again, Deputy Premier, I couldn't ask for a better Deputy Premier, and Minister of Health, Sylvia Jones, Minister of Mental Health and Addiction, Michael Tibollo, and Michael, I'm going to add Dr. Michael Tibollo. When it comes to mental health and addiction, there's no one brighter down at Queen's Park than Minister Tibollo, and thank you for all your work too. and MPPs Natalie, Pierre, and Effie Triantafilopoulos. But I want to just mention about Natalie here for a minute, the work that she's done, the advocacy that she's done, the endless calls she has done to me and coming in the office. So we're just so proud of you, Natalie. You're just a true champion. Honestly, without her voice pushing this, this might not have happened. But before I begin, I want to acknowledge and welcome Regional Chair Carr and the great Mayor of Burlington. Mayor, great to see you. Marianne Mead Ward, you're doing an incredible job. And anytime I get a little line, guess who calls me? The boss over there. So I appreciate the calls there. I want to give a big thank you to Eric and Barbara and the whole entire team at Joseph Brant Hospital for hosting us today. I just said hello to the true champions right behind me. Without these folks behind me, the healthcare system would collapse, and I just want you to know how grateful we are and for the incredible work you're doing right here, delivering outstanding care to tens of thousands of patients every year. When I walked out in the front in the lobby, a gentleman I've never met before comes up and said, "This is our greatest hospital. They're taking care of my wife. And by the way, why are you here?" So I told him. But he was a big promoter, I'll tell you. I also want to give a big shout out to the foundation, especially Michael and Laura Paletta as the lead donors and all the other donors here today. When we make these announcements around the province, this would not happen without the foundation, without the donors, and the philanthropy that we've seen in this province is second to none. They've been working tirelessly to raise money and expand JBH's Mental Health and Addictions Unit. Our government understands just how vital mental health care is to the well-being of everyone here in Ontario. Since 2018, we've prioritized improving and expanding mental health services. And today, we're pleased to announce that, building on your tremendous efforts, our government will be building a new mental health unit at Joseph Brant Hospital. So that's amazing. That puts a smile on everyone's face. That's great. The province's investment will help create a state-of-the-art space for inpatient and outpatient services designed to meet the growing needs of the community. It will include a renovated inpatient adult mental health acute care unit, enhanced child and youth care programming, and a new adult outpatient space better suited to improve clinical flow and patient care. The expanded facility is a major step forward in improving mental health care here in Burlington and throughout the region. It's going to help ensure that Joseph Brant's hardworking doctors, nurses, and other staff have the tools, spaces, and the resources they need to deliver timely and high-quality mental health and addictions care, all in a safe and comfortable settings. Friends, with this investment, our government is delivering on our promise to connect more people to convenient health care closer to home. Across the province, we're investing almost $50 billion over the next 10 years, as the Minister of Health mentioned, to support more than 50 new hospitals or hospital expansions. We're investing an additional $4 billion to better connect people to mental health services because, as we say, mental health is health. This investment includes new funding to connect children and youth to mental health supports, including expanded text, talk, and online services. We're enhancing care for anxiety and depression. We're providing more supportive housing and services for people living with mental health and addictions challenges, and we're connecting more first responders to mental health supports they need. We're treating mental health with the seriousness it deserves, and we're so grateful to have great donors like the Palettas and other people, great partners here at Joseph Brant Hospital, working alongside us to get it done. Together, we're creating a system that delivers the care patients and families need when and where they need it most. Once again, I just want to thank everyone for joining us today, and may God bless the people of Ontario. Thank you so much. Thank you.
right. Good morning, everyone. Good morning, everyone. It is my distinct pleasure to be here today. My name is Barbara Elliott. I'm the chair of the Joseph Brant Hospital Board. And on behalf of the Joseph Brant Hospital and Board of Directors, I would like to express our sincere appreciation to Premier Ford, Minister Jones, Associate Minister Tibollo, for their strong support of this initiative and their ongoing commitment to enhancing healthcare in our community. A very special thank you to our very own MPP, Natalie Pierre, for her unwavering dedication to improving mental health and addiction services in our community. This project would not have been possible without her leadership, advocacy, and tireless work. It is now my pleasure to introduce Michael Paletta. Michael and his wife, Laura, announced a transformational donation of $5 million to the For All Minds campaign in January of 2024. In recognition of this generous gift, we are very proud that the newly redeveloped unit will be named the Michael and Laura Paletta Mental Health and Addictions Inpatient Unit. Thank you, Michael and Laura, for your generous support and leadership. And love to have you come up. Here we are. Okay.
Thank you for inviting me here today, myself and Laura. I'd like to thank the Government of Ontario, including Premier Ford, Minister Jones, Associate Minister Tibollo, and MPP Pierre for being here today to share this outstanding news with our community. We have all heard the staggering statistics about the growing demand for mental health and addictions care. In any given year, 1 in 5 people in Canada will personally experience mental health illness. And by age 40, nearly 50% of the population will have or have had a mental illness. Mental illness impacts the lives of so many people in our community and beyond, and the time is now for us to come together to ensure everyone has access to the care they need. My wife Laura and I are proud to have joined the For All Minds campaign and are fully in support of the project to redevelop and expand the Mental Health and Addictions Unit at Joseph Brant Hospital. Our family has seen firsthand the impact of mental illness and deeply understands the value of innovative and life-saving care. Laura and I firmly believe that this project will transform mental health and addictions care right here at Joseph Brant Hospital in Burlington. Thank you once again to the Government of Ontario for recognizing the incredible work being done at Joseph Brant Hospital and sharing the vision of what this new and improved space will do for patients, caregivers, and our entire community. Together, we will build better mental health care. Thank you.
Okay.
We will now go to reporters' questions. Reporters, please line up the mic behind me. Please identify yourselves by name and outlet. It'll be one question, one follow-up. First question.
Hi, Chris Arnold with Burlington Today.
Hi, Chris. How are you today?
Good, thank you. Any word on the cost of the new unit for mental health?
Maybe you want to pass that over to the Minister of Health there.
Thanks. So as we finish through the final planning process with the Joseph Brant leadership and then tender, then we will have the numbers to be made public. We don't actually publicize them because we haven't tendered the project yet.
And any expected date that the people of Burlington can start using it, when it'll be open?
Oh, I'm going to let Eric share that good news.
Thank you, Minister, and great question. So in April of 2025, we're going to start doing some early work, so it's preparing the space as we finish the planning for the inpatient unit. The inpatient unit is scheduled to start in January 2026 and finish about 9 to 10 months after that, and on the heels of that, we will then start the child and adolescent outpatient expansion project, which is another 9 to 10 months. So almost 2.5 years all said and done. Thank you.
Mr. Premier.
Hi.
Craig Campbell from the Burlington Post.
Hi, Fred.
Craig, sorry.
Oh, Craig, sorry. I thought you
That's
said,
all right. No
sorry, I
problem.
apologize.
I've been called worse.
So have I.
In common. There's been some local opposition expressed to the province's proposed Bill 212, locally due to what some people see as interference with local transportation decision-making, hoping that the legislation would support rather than supersede local government initiatives. Are there any ways you can comment on that the province can support local efforts to reduce traffic and improve road safety, such as further expansion of GO Transit to handle increasing volume?
Sure. Well, thank you so much for that question. Let's start with the GO Transit. We've increased across the province over 300 more trips through GO Transit. We're investing a record amount of $70 billion in transit around our province, making sure that people have the option of getting out of the cars and hopping on the GO or local transit options. We're expanding, obviously, the Toronto Transit with 5 different new lines, approximately $30 billion. And as for your mentioning override, we're really focused on the congestion in Toronto. It's the worst congested city in North America, 3rd worst in the entire world. Even to the point last night, it was embarrassing that, the Utah Hockey Club has to get out of the bus and start walking to the hockey arena. It's just unacceptable. People are avoiding downtown. It's taking up 50% of the traffic, and we're focusing on 3 or 4 roads to get it moving. So we're going to work collaboratively with the mayor, which she believes the Bloor Street West should not be there. Previous mayor admitted that he made a mistake, and I love the guy too. Mayor Tory shouldn't have put down Yonge Street, shouldn't have put in Bloor West. Former fire chief, Chief Pegg, just came out, said he was never consulted with. It was causing delays getting to emergency locations. There was no consultation in Bloor Street as well. So we're going to work with the mayor, and I'm so fond of the mayor of Toronto. We get along extremely well. We may disagree on certain issues, but no different than your great mayor here. We may agree or disagree, and we work together. We have to work with 444 mayors, and they're the people that keep the province moving. So we're very grateful. But when Toronto is controlling 50% of our GDP of $1.2 trillion, so 50% of that to get goods and services moving, well, we have to get things moving.
Was there anything in particular in Burlington that you might be focused on, or is this all really you're focused on Toronto?
I think the mayor's doing an incredible job here, and I don't see traffic jams and people getting out of buses to walk to their location and everything else. Toronto is an absolute nightmare right now around the world, around North America. And even when that Sebastian, that famous comedian, gets up, the first thing he says is, traffic's terrible in Toronto. Anyone that comes to Toronto, and people are just avoiding going downtown now, and it's going to hurt our GDP in total. I always believe in working and putting bike lanes in secondary arterial roads, just like my brother Rob, when he was down there with myself, we spent over $90 million putting in bike paths and bike trails. So it's not anything against bike people. Just go on the secondary roads, and you can't take up 1% of the population cannot take up 50% of the roads.
Morning, Premier Lane Harrison, CBC News.
Hi, Lane.
So today is the International Day for the Elimination of Violence Against Women. So I wanted to ask you about intimate partner violence. Some critics say your party has used delay tactics to avoid declaring it an epidemic in the province and used up valuable taxpayer resources on an issue that's been studied over and over. So what's the holdup when it comes to declaring IPV an epidemic?
Well, you know something, we're 100% behind making sure there's zero violence against women. I have 4 daughters. And anyone ever touch my daughters, it'd be the worst day of their lives. And that's for anyone out there. It's unacceptable. And I have zero tolerance for any sort of violence against women or anyone in that fact.
So in 2019, the Auditor General recommended your government track why so many court cases are being tossed by the justice system in order to help solve that issue. But your government has refused to track this problem. Why?
Well, first of all, let's talk about what our government has done. We've invested over $30 million to hire 25 new judges, justices of the peace, Crown attorneys to make sure we speed up the process. But let's go to root cause. I'm a big believer, go down to root cause. When people are let out on bail, not once, not twice, 3, 4, 5 times, and going back into the system, that's what causes the delay. We need the federal government to toughen up bail reform, make sure we have mandatory sentences. So when people are right here in Halton, I've heard it from Burlington to Oakville in the region, you know, people are getting their cars stolen right out of their driveway, as the mayor knows. In some cases, doors are kicked in violently, put guns to people's heads, handing over the keys. It's unacceptable. And then guess what happens? Go in front of a JP or a judge, and they get let out just to do the same thing the following day. When there's no consequences to people, they won't learn. We need to throw them in jail, keep them in jail. These violent criminals. It's unacceptable, and we'll do everything we can to make sure we keep these thugs that terrorize our neighborhoods in jail and toughen up the laws and mandatory sentences and bail reform that we led the charge, our province, with all the other premiers, to advocate for the federal government to change bail.
Good morning, Premier Ford. My name's Danielle DeGraw. I'm with CHCH News here in Hamilton. You mentioned as part of the announcement that there is going to be the child and youth wing of this mental health area in Brant Hospital, but I'm wondering what specifically in the program is going to be directed to LGBTQIA youth and trans kids, and what you're going to do as part of that program to help them specifically.
I think I'll pass it over to the experts.
So first of all, the expansion of the Child and Youth Wing is really important and needed. And as Eric mentioned earlier, it's going to be the second phase of the project. And I want to be clear, you know, our health system and our exceptional health clinicians are here to provide services for all Ontario residents. This dividing and division is not what we see in our healthcare system. We see a system and providers and professionals who assist and provide treatment for all Ontario residents. Thank you.
Yeah, can I ask a follow-up?
Oh.
Yeah, I was just going to ask a follow-up to that.
Yeah, go ahead.
When you, obviously, that this is a program for all peoples that have mental health issues, but specifically what kind of training is this new wing going to be given to, though, because you mentioned first responders. Are first responders who come on the scene to help, are they going to be trained on the proper way to interact with, say, a trans person or an LGBTQ person, because there's still a disconnect?
So the program that the Premier, an investment that the Premier referenced, is actually assistance for first responders, and it is not related specifically to Joseph Brant. It is a program that we are doing to make sure that people who have and see challenging things as part of their work have the opportunity to access mental health services. And so that program is actually a partnership with Runnymede in Toronto that will have a secondary location that will be more focused on the natural environment. And so that was that program that we were talking about specifically for first responders.
Last reporter.
Hello, Premier.
Hi.
Laura Stone, Globe and Mail.
Hi, Laura. How are you?
I'm great. How are you?
Good. Welcome to Burlington.
I live here. I love it.
That's good. I like that.
We had a story last week about the supervised consumption sites and concerns from some legal experts and harm reduction advocates who think that there might be a breach of charter rights in your bill because you're preventing new sites from being open. How confident are you that this bill would survive a charter challenge, and would you be willing to use the notwithstanding clause to push it through?
Well, I respectfully am going to disagree with the experts about putting safe injection sites beside schools, beside daycare centers, by parks when there's needles all around and drug dealers show up there. What we're doing, and I'm going to pass it over to the Minister of Health here in a minute, we're investing $378 million, 3 times the amount of a safe injection site, and we're helping them go into a detox bed, rehabilitation center. We're going to help them find gainful employment, get a roof over the head. It's going to be 19 sites all around the province, rather than a place that encourages you to, here, come and do drugs, and drug dealers and needles all over the place. I have yet to find one community that says, I want a drug injection site beside my house. I want it beside my school. I want it beside my daycare. There isn't one jurisdiction in this province. What they do want, and what I want to give them a hand up, give them the proper support that they need, and get them back on their feet and part of society. That's what I'd like to see, but I'll pass it over to my Minister of Health or the Minister of Mental Health and Addiction as well, maybe after.
So there's lots of examples where the provincial government will have an approval process to make a determination on where individual organizations are cited. I think of cannabis shops. So when we put in the legislation that we were very clear we did not want a consumption site within 200 meters of a school, a daycare, or an early on center, it was an acknowledgement that those are not appropriate communities to have open consumption. And so the heart hubs that the Premier mentioned, that's that full service model that we so need, and frankly, individuals deserve. So whether they need social services today, whether they need mental health supports, whether they need addictions treatments, whether they need access to supportive housing, these heart hubs bring all of those services together with many existing organizations and communities coming together and submitting those proposals. And I'm really excited that we're actually moving away from just enabling, and we're actually providing that full spectrum of support. And I will say that the response from many mayors who have been struggling with these issues in their communities see the Heart Hub model, that bringing together of organizations, as a very positive step. And those 19 demonstration sites that we will ultimately approve and ramp up for early next year will be monitored very closely to see where is the success happening, where can we do better, and then we will look at how we can continue to make those investments as we have already.
Okay, thank you. Premier, I wanted to ask...
I'm
oh,
sorry,
yes.
Laura, can Michael speak on that too?
Yeah, and maybe you can address the charter issue too, Minister. Is this charter compliant?
Sure. Just to build on what Minister Jones was saying, treatment and recovery is the focus of our government, to ensure we build a continuum of care in the community to meet people where they are, but to provide them the supports that are necessary to ensure that they get the best chance at recovery. And one of the things that we did that is a predecessor to the Heart Hubs is the Addiction Recovery Fund. That fund of $90 million is opening 400 beds. 280 of those beds are actually in operation now, with over 10,000 unique new visits of individuals going and seeking help and getting the help that they need. And so the evidence that supports the work that we're doing is clear, that if you build those resources into the community and provide that continuum, right from whether it be shelter beds to withdrawal management to treatment beds, and then of course the supportive transitional beds that you need subsequent to that, we know that that is the system that is going to work and ensure that people get the best opportunity to recover. Now, when it comes to meeting the person where they are, we have all kinds of low barrier access points for individuals to get into that support, that care. Mm-hmm. And every model that has been demonstrated, whether it's here in the province of Ontario, across Canada, the United States, any jurisdiction, Portugal, Australia, anywhere you go, you see that the foundation of a system is treatment and recovery. And that's the system that we're building because we know that there is evidence that supports it and it will make a difference in people's lives. Now, in terms of what we're providing, meeting an individual where they are is extremely important. But we know that no one wants to be an addict. No one wants to continue with an illness. And if we're not providing those supports and services, then really that is the fault of the government. But in our case, we are building that system exactly to meet that need, because that is a fundamental right of an individual to get the care they need where and when they need that care. And that's what we're building the system to do.
Thank you. Premier, I apologize for asking about bike lanes again, but
That's all right.
I don't think you have quite explained to the public why you're protecting the government from lawsuits if a cyclist is injured or killed. I know you said on Friday you want everyone to be safe, obviously, but it really looks like you're trying to cover yourself if something bad happens once you remove these lanes. Why would you put that into your bill?
Well, first of all, my heart goes out to anyone that gets killed on the bike, and it has happened. I think 3 people, unfortunately, have lost their lives with the bike lanes we have right now. No one wants that to happen. No one wants anyone to get killed in a car or motorcycle or so on and so forth. We want to make sure that we still have a safe system to keep bike riders safe. I don't want anything to happen to anyone. So we're going to work with the city. We're going to come up with different ideas. And there's more than one way to come up with an idea. I think I mentioned before University Avenue, and you're very familiar with University, so am I and other people. Number one, it's unacceptable to even put it down Hospital Row there. But secondly, a caller, because I'm getting a lot of calls from both sides actually. And one person said, yeah, I'm a bike rider, but I have an idea, and I love that. The sidewalks are 70 feet wide on University. Can we take 10 feet out? Or another person called me and said, the median down the middle of University Avenue, that, it's clear. Actually, it's not clear. All the 10 people are there too. But it's, you could create a bike path down there. So it's not, I always say it's not either or, it's and. Let's work together and have a safe pathway for bikes and keep cars and vehicles moving. That's what we need to do. That's what we're going to work collaboratively with the mayor as well.
This concludes the media conference.
Well, thank you so much again. Congratulations to everyone here. Our government's going to continue to be focused on health and mental health and addiction. And I'm so grateful for all the leadership here, and especially all our great docs and nurses and healthcare workers behind me. I just wish them all the very best, and God bless. Thank you.